Good morning. We're going to start here in 1 second. Thank you for joining us. And welcome to the business case for becoming a baby-friendly hospital webinar. I'm Jennifer Delaporte, the breastfeeding specialist for the Prevention Services Division at the Colorado Department of Public Health and Environment, and will be moderating this webinar. Just a few points about using live stream. This is new technology for us, so I hope you'll be patient with us. But you might want to maximize your screen for better viewing and use the chat area in the upper right-hand side to enter your email address. We have no way to know who participated unless you put in your email address as a comment. And also use that area to note any questions you have. And after the webinar, we'll address questions, or after the main presentation, we'll address questions. After this webinar, what I'd like you to do is return to this live stream link and use an additional link to complete a very short evaluation, which will also link you to the handouts for the presentation. So no need to take notes. Dr. Neifert has provided very thorough handouts for you. Just participate by watching today. And the purpose of this webinar is to inform you about becoming a baby-friendly hospital and describe some of the benefits to becoming certified as baby-friendly. Our hope is that you'll gather some compelling information to help you gain support from your hospital's administration to consider becoming a baby-friendly hospital. And the state health department is actually forming a hospital collaborative with the intent to help these hospitals move through the baby-friendly hospital process as a group, and that's going to take place later this year, and we hope your hospitals will apply. In June, an invitation will be sent to your facility if you want to apply for the collaborative. In July, we'll let you know if you've been accepted into the collaborative. In August, we'll ask those in the collaborative to complete a needs assessment so we can inform our collaborative process. And finally, in September, we hope to have some kind of a workshop with collaborative members to do some networking and technical assistance. So we're going to start now. We have 3 guests today, Dr. Neifert and 2 breastfeeding hospital, baby-friendly hospital experts, Eileen Meisner and Karen Moore, who so kindly volunteered to field questions toward the end of the webinar. So I'm thrilled to introduce our first speaker, Dr. Marianne Neifert, who is known nationwide as Dr. Mom, and Dr. Mom is a pediatrician and nationally recognized expert in lactation management. She possesses a strong theoretical background in lactation management and has a wealth of practical experience. Since 2008, many of you met Marianne as she traveled around the around the state, meeting with hospital staff to discuss how to best support new breastfeeding mothers and babies, as well as training on the Colorado Can-Do 5 breastfeeding supportive practices. And Dr. Neifert founded the Denver-based Lactation Journal Club in 1987 and has been providing ongoing breastfeeding education and updates for Colorado health professionals for over 25 years. And that journal club just recently started webcasting its meetings. So if you want to know more about that, write a comment in and we'll make sure we provide you the information on how to participate in those webcasts. Those are monthly meetings or monthly lactation journal clubs. Dr. Neifert is also a clinical professor of pediatrics at the University of Colorado Denver School of Medicine and a founding member of the Academy of Breastfeeding Medicine. And I don't think you even see her, I'm looking at her. Co-founder of the Denver Mother's Milk Bank and the Human Milk Banking Association of North America, and she's a member of the American Academy of Pediatrics section on breastfeeding, and we are so very lucky to have Marianne on our side and in our state. So thank you, Marianne. I'll let you take it from here.
Thank you very much, Jennifer. And thanks to all of you that are participating in this webinar. I'm going to get started because we want to cover a lot of information in a short period of time. We're going to first talk about why breastfeeding is important. And can we have the first slide, please? We're going to just briefly review the agenda. Next slide, please. And we're going to talk about why breastfeeding is important. Next slide. And briefly introduce what the WHO UNICEF Baby Friendly Hospital Initiative is all about, and then make a case for why does the baby friendly designation make good business sense in my hospital. So to talk about why breastfeeding is important, one nice way to do that is to look at the recent 2012 American Academy of Pediatrics Breastfeeding Policy Statement. And in this policy statement, I'm sure you're all familiar with it, but they reminded us that breastfeeding and human milk are the normative standards for infant feeding and nutrition. They reminded us that breastfeeding is a public health priority. It's no longer considered just a lifestyle, personal mother's choice. They reaffirmed their previous recommendations of exclusive breastfeeding for about 6 months. And they also indicated that as an alternative to breastfeeding, when necessary, we can use express milk or donor milk. The AAP policy statement did address the Baby Friendly Hospital Initiative. They reminded us that the AAP has endorsed the 10 steps, and they called for a major conceptual change in the organization of hospital services so that we can ensure that all mother-baby pairs get uniform and optimal early breastfeeding help that helps them breastfeed exclusively. Next slide, please. Next slide, please. In the policy statement, there was a great emphasis on the dose-related health benefits of breastfeeding. And so much of the statement was focused on outlining the various infant health benefits of breastfeeding and giving the evidence that these benefits are related to exclusive breastfeeding and that they are indeed dose-related. Just to give you a few examples, you can find more of this in the policy statement, which is always available from a free download from aap.org. But take, for example, the devastating and costly premature condition, necrotizing enterocolitis, which causes tremendous morbidity and mortality. Any breastfeeding of premature infants, use of human milk in the preemie nursery reduces NEC by 58%. But if we can exclusively have these babies breastfed by also using human milk fortifiers for their feeding, that actually reduces NEC by 77%. Another example of the dose-related response is that exclusive breastfeeding for greater than 4 months reduces the risk of being hospitalized for lower respiratory tract infections by 72%. Any breastfeeding at all associated with a significant reduction, 64%, in gastroenteritis. Also, any breastfeeding reduces otitis media by 23%, but exclusive breastfeeding for more than 3 months reduces otitis media by 50%. And of course, there's a lot of interest these days in the role of breastfeeding in reducing childhood and adult overweight, and this also is in a dose-response manner. New data also shows us that breastfeeding reduces sudden infant death syndrome by 36%. So you can read more of this in the policy statement. It does not acknowledge something that each of you already knows, that many mothers breastfeed and because they greatly enjoy the intimacy and the closeness and the security and the bonding that babies are afforded by breastfeeding. So yes, there are even additional benefits that are hard to quantify and measure. Next slide, please. Now, another benefit of breastfeeding, and for considering the baby-friendly hospital journey for your hospital, is that successful breastfeeding can save your facility money. It can reduce non-compensated newborn hospital admissions that are the result of preventable infant morbidities. We know that breastfeeding confers many health benefits, but inadequate breastfeeding can actually increase readmissions for neonatal hyperbilirubinemia. I'm sure you all know about the feeding difficulties in late preterm infants that can make them have difficulties breastfeeding and also lead to an increased risk of readmission for these babies for feeding problems, jaundice, and rule out sepsis. So successful breastfeeding reduces infant morbidity, but mismanaged unsuccessful breastfeeding can actually increase readmissions. Throughout this presentation, I've sprinkled the mission statements from many of your hospitals, and I hope that in reading those that you can be periodically reminded during the presentation of why the Baby Friendly Hospital Initiative dovetails nicely and reinforces your hospital's mission statement for providing affordable, high-quality health care. The AAP policy statement also addressed maternal health benefits of breastfeeding, and while we have less data about the dose-response relationship, we have mounting evidence that cumulative breastfeeding experience, lifetime breastfeeding experience, the total breastfeeding experience together helps reduce type 2 diabetes at midlife, cardiac morbidities, rheumatoid arthritis, and we've long known that breastfeeding reduces breast cancer, predominantly premenopausal breast cancer, in a dose-response manner. Next slide, please. Now, many sometimes have a few naysayers who say, well, this is all well and good, but I was formula fed and I turned out pretty good, or breastfeeding didn't work for me, but my son just got into Stanford. But one of the things I want to remind folks, it's called the Rose theorem. And the idea is that even a small difference at the individual level, when multiplied by more than 4 million mothers and babies each year, can have a very powerful, significant difference on the whole population affected. So that promoting breastfeeding and improving the health, even a little bit, of mothers and babies through our nation can have a profound effect on the percentage of people who become healthy or unhealthy. I won't read each of these mission statements, but I just want to remind you again how the Baby Friendly Hospital Initiative does dovetail with your hospital's mission statement. Now, many people have tried to quantitate the economic benefits of breastfeeding, and a recent study was published in Pediatrics showing that if we could get 90% of mothers to be able to meet ideal infant feeding recommendations of exclusive breastfeeding for about 6 months, the health cost savings from reduced morbidities in mothers and babies would amount to about $13 billion per year. And that doesn't even account for reduced costs by the cost of parents staying home from work or diseases acquired in childhood that manifest in adulthood. Colorado performed, a study was conducted in Colorado by folks at our own health department. The lead author was Debbie Montgomery several years ago, and she was able to do a study comparing Medicaid expenses in a cohort of fully breastfed babies compared to fully formula-fed babies in the WIC population. And she found that the Medicaid expenditures in the first 6 months were $112 lower for breastfed babies compared to formula-fed infants. And the mean Medicaid pharmacy payments were significantly lower for the breastfed compared to the formula-fed cohort. Recently, Louisiana conducted similar data and found $200 million savings if they could have ideal breastfeeding in their state. Now, let's look at breastfeeding in Colorado. We're in a state where the vast majority of mothers want to breastfeed. And as I look at these numbers, I want you to think about what your hospital's breastfeeding rates might be and how they might be improved by the Baby Friendly Hospital Initiative. Nearly 90% of mothers in Colorado want to breastfeed. More than half are still doing some breastfeeding at 6 months, and more than a quarter are doing some breastfeeding at 12 months. But if we look at exclusive targets, and exclusive is where we get the maximum health benefits for mothers and babies, we have just 50% of mothers fully breastfeeding at 3 months, and just a little over 25% exclusively breastfeeding at 6 months as recommended. While that's good news, the flip side of that is that we have 3/4 of Colorado mothers and babies who are not achieving the full health benefits of exclusive breastfeeding for about 6 months. Nevertheless, I do celebrate the fact that we're in a state where people want to breastfeed, and we're raising a new generation of young ones that have seen breastfeeding, and we are really seeing breastfeeding become the community norm, or at least initiation. Now, at the same time, we have disparities in breastfeeding rates. We know that breastfeeding nationwide is lower among low-income, low-income mothers, mothers with less education, ethnic minority mothers, mothers in rural areas, and indeed in Colorado, if you look at the various Colorado counties, the tan-colored counties in the northeast and southeast parts of the state have the lowest breastfeeding rates in the state, and we have geographic disparities in our own state. Now, one of the recent things that we are excited about nationwide is that there's several national initiatives focusing on breastfeeding. One of these is that in 2011, Dr. Regina Benjamin, the Surgeon General's office, released the Surgeon General's call to action to support breastfeeding and emphasized that breastfeeding is indeed a public health issue in the United States. Next slide, please. Now, what I liked about this call of action, that's quite exciting, is that the focus was that we need to shift the emphasis in breastfeeding promotion from focusing on a mother's personal choice to making society-wide institutional changes that support breastfeeding mothers. And a big focus in this document was on the need for hospitals to implement supportive maternity care practices to reduce barriers to breastfeeding. Now, in conjunction with this, we have breastfeeding is so important that the CDC has Healthy People 2020 breastfeeding goals and objectives, and among those are the need to increase the proportion of births that occur in facilities providing ideal maternity care practices, and that would be ideally the Baby Friendly Hospital Initiative. The goal is for 8% of all U.S. babies to be born at baby-friendly facilities. In Colorado, we have almost achieved that with 7.72% of births. But another way to look at that is that we have more than 90% of babies are being born at hospitals that don't provide recommended care for lactating mothers and babies. Another breastfeeding goal for Healthy People 2020 is to reduce formula supplementation in the first 2 days of life to below 15%. In Colorado, the current rate is 19.5% of newborns are getting breastfed newborns are getting formula supplements in the first 48 hours. And another goal is to increase the proportion of employers that offer lactation support programs. And certainly hospitals are major employers and can set the standards and the model for lactation support in the workplace. Next slide, please. Now, another thing that your hospital will want to be aware of and that Baby Friendly will help you achieve is the Affordable Care Act's new no-cost sharing preventive services mandate. There are 8 new preventative services for women that are mandated to be covered under a no-cost sharing provision, and one of those 8 is breastfeeding support supplies and counseling. So when your hospital is baby friendly, you will be meeting this by providing comprehensive lactation support prenatally and in the postpartum period. Another requirement of this is to cover costs for renting breastfeeding equipment, and this is for plan years beginning August 1st, 2012. And the reason behind this is the recognition that breastfeeding is one of the most effective preventive health measures mothers can take. So let's get right into the Baby Friendly Hospital Initiative. Let me give you a little background information. This is a global WHO UNICEF joint initiative that was implemented in 1991, more than just about 22 years ago. And the purpose was to ensure that maternity facilities do optimally support and protect breastfeeding. The model policies are called the 10 Steps to Successful Breastfeeding. They're evidence-based policies. Worldwide, Baby Friendly has been very popular with more than 20,000 facilities in more than 150 countries. However, it has been slow to gain ground in this country until recently. Right now, we have about 3,200 hospitals and birthing centers, maternity hospitals and birthing centers in this country, and only 154 are designated baby friendly, which is barely 5%. However, the good news is that there are a number of others on the path to baby friendly. Colorado has 3 baby friendly hospitals and a number of others that are on the path. And speaking of the baby friendly path, I want you to know that there is lots of support for becoming baby friendly, and a few years ago, babyfriendlyusa.org did develop what they call the 4D pathway to the baby friendly designation, so that there is a discovery phase, then a development phase, dissemination phase, and then finally the designation. This stepwise progression that's been outlined clearly, and many of these, there's so many resources at the Baby Friendly USA website, but this has enabled hospitals to really be more focused about what they need to do each step of the way, and to sort of expedite and give you just a little path to follow to become fully baby friendly. Now, the reason that we're so excited about this Baby Friendly Hospital Initiative is that there's so much evidence that despite the brevity of the post-birth hospitalization, supportive maternity care practices has been shown to be an evidence-based intervention that does increase breastfeeding initiation, duration, and exclusivity. This has been looked at in a variety of ways. For example, if you compare baby-friendly designated hospitals with non-baby-friendly facilities, there are consistently higher initiation, duration, and exclusivity of breastfeeding in the baby-friendly facilities. Another way well, one other thing I want you to know that's very important is that you don't even have to do all 10 steps to, or be designated baby-friendly to make a difference, that there are even incremental changes improve breastfeeding outcomes. So just getting on the path and starting to implement some of the policies makes a big difference. Another way baby-friendly has been evaluated is in terms of looking within a hospital and looking at their breastfeeding rates before and after becoming baby-friendly. An example of this is Boston Medical Center, which is an inner city hospital, teaching hospital serving a very large low-income population, and they compared their breastfeeding initiation and in-hospital exclusive rates before, during, and after becoming baby-friendly back in the 90s. And they found that breastfeeding initiation increased very significantly, as you can see here, and exclusivity in particular increased from only 5% before they were baby-friendly to 28.5% while they were on the path, and reaching a 33.5% after the baby-friendly designation. They also found that they were able to increase breastfeeding rates in U.S.-born African-American mothers, with a population that currently has the lowest breastfeeding rates in the nation. So let me briefly just outline what the Baby-Friendly Hospital 10 steps to successful breastfeeding are, just to give you a brief overview. Step 1 is to have a written breastfeeding policy. Obviously, you have written policies now, so this is just a matter of making the policies address all 10 steps. Step 2 is train the healthcare staff, and of course you have staff training now, but there is a specific training requirement of 20 hours for nursing staff. Step 3 reminds us that breastfeeding support begins prenatally and continues throughout the hospitalization into the postpartum period. And step 3 says that if you have an antenatal clinic affiliated with your hospital, you need to inform all pregnant women about the benefits and management of breastfeeding. Step 4 is what I would consider an anchor step, one of the most important steps. Help breastfeeding be initiated within the first hour of birth, and of course the process for achieving this is to place babies immediately skin to skin until that first feeding is accomplished. And there's much data showing that this is linked with better rates of exclusive breastfeeding in the hospital, which is one of the most powerful links with long-term breastfeeding exclusively. Next slide, please. Step 6 is show mothers how to breastfeed, and even if they're separated, such as a mother having a high-risk infant, that they've shown how to express milk and provide for their babies. Step 5. Step 6 is that feed infants nothing except breast milk unless there's a valid medical indication for supplementation. Part of step 6 is that formula used in the hospitals would need to be purchased by the facility and not accepted free or promoted in any way. Now, many hospitals have the perception that this means that this would increase tremendously their costs, and the next slide I will show you that that's not necessarily, that's not the case. Step 7 is continuous rooming in round the clock, allowing mothers to be together 24 hours a day. Recently, in pediatrics, there was a study comparing the cost per birth in baby-friendly hospitals and comparable-sized non-baby-friendly hospitals. It turned out that the cost per delivery was $35 higher in the baby-friendly hospitals, but that was a non-significant difference. So once a hospital has become baby-friendly, it is essentially cost-neutral. Step 8 is to encourage breastfeeding on demand, to allow mothers to be with their babies and feed them on cue. Step 9 is to not use artificial nipples or pacifiers, and this would involve using alternative methods of supplementing breastfed babies when necessary to avoid using a nipple. And as I said earlier, we now understand that this breastfeeding support not only starts prenatally, but there needs to be a seamless transition from hospital care to community care. And so that involves fostering the establishment of breastfeeding support groups and referring mothers to these, and in many instances, hospitals offering the support groups and the follow-up care themselves, which has become an entirely new community norm. Now, Jennifer mentioned in the introduction that Colorado, from PRAM's data, found by asking mothers about their hospital birthing experience and the maternity care practices they experienced, they found that 5 of the baby-friendly 10 steps were significantly linked with the longer duration of breastfeeding. And this is very powerful information because breastfeeding was enhanced in all socioeconomic groups. So this was the basis for that. They ended up calling these 5 policies the Can Do 5 because so many hospital staff said, hey, we can do that. And they were excited to get on the path toward baby friendly. And now, several years later, more than 60% of Colorado hospitals now have policies for the Can Do 5 hospital practices, and they are well on their way to being baby friendly. And that's probably many of the hospitals that have participants at this webinar. The health department has given BEST awards, Breastfeeding Excellence Starts Today, to the hospitals that have Can Do 5 policies, and there will be one more round of those awards if you can get your application in and submit your policies by May 31st. So this is quite exciting information, and we hope that if you have not done the Can Do 5 that you will implement these policies and apply for the BEST award, and that all of you that already are doing the Can Do 5 will realize that you're already well on the path to baby friendly and will now continue until you've implemented all 10 steps. I wanted to just add a little something that I call these bonus outcomes. I don't yet have data for this, but there's so many anecdotal accounts from nursing staff telling me that when babies are breastfed in the first hour, a bonus outcome is that there are fewer newborns that they're finding with low blood sugar and requiring temporary oxygen and needing nursing staff to help them wean off of that. When babies room in with their mothers, there's less staffing and needs to care for babies in the nursery at nighttime and a cost savings there. When infants are fed only breast milk and are not supplemented, I just can't tell you how strong the evidence is that exclusively breastfeeding in the hospital is the best chance for a mother to reach her long-term exclusive breastfeeding goals, and this can have such a powerful impact. I've had hospitals say that they've saved money by not using pacifiers because they were buying 1 to 3 pacifiers per infant, and that added up in a large delivery service. I guess I'll just quote a nursing director who said when they began implementing the follow-up breastfeeding services for mothers, her bonus outcome was that the patient satisfaction surveys went through the ceiling because mothers in Colorado want to breastfeed, they deserve help breastfeeding, and they're deeply appreciative of that help. Well, the Baby Friendly Hospital Initiative is so important that it has now got national attention, and I want to share with you about a national initiative, and it's also getting tremendous focus here in Colorado. So the Centers for Disease Control and Prevention have partnered with a nonprofit called the National Initiative for Children's Healthcare Quality, or NICHQ, and they're working together with Baby Friendly USA on a national collaborative. The hospitals applied to participate. 90 were selected. I think 89 are still involved. And we're very proud that our own Memorial Hospital Central in Colorado Springs is one of those hospitals. These folks are participating in learning sessions, regional learning sessions, and they're part of a 22-month collaborative to implement the kind of fast track them on the baby-friendly journey. Next slide, please. I had the privilege of participating in one of these learning sessions, this one in St. Louis, and 5 members from Memorial Hospital Central were there. They have been so gracious and sharing with others at our Lactation Journal Club, and I'm sure we'll find other venues to hear about their journey and the process they're going through, and this is a tremendous way for you to benefit and learn from the hospitals in Colorado that are already baby friendly, as you're going to hear in the Q&A afterwards, as well as Memorial, who is part of this collaborative. Another reason that your hospital is going to want to be baby friendly is that your hospital policies are being surveyed. The Centers for Disease Control and Prevention implemented in 2007 a national, it's a biannual survey of maternity practices and infant nutrition and care. It's nicknamed the MPINK survey, and hospitals submit this information every other year. Right now it's an anonymous survey, and nationwide on a scale of 1 to 100, the national average MPINK score has increased in recent years from 65 to 70. Colorado's score is 77, which is higher than the national average, and that's a good thing. But another reality is that Colorado received a needs improvement score in 4 areas: the need for model hospital policies, the more appropriate use of supplemental feedings, and post-discharge breastfeeding support and assessment of staff competencies. Another reason to become baby-friendly is it's about time for all of us to look at the issue being prompted and nudged to ban the formula discharge gift bags. This has been a long-standing relationship, but a highly inappropriate one. Giving a formula product implies the hospital's endorsement not only of formula feeding, but worse yet, of a specific formula product. Your administrators may not realize that this policy violates the WHO Code of Marketing of Breast Milk Substitutes, and if you recall those mission statements we've been flashing by, it undermines your hospital's efforts to promote good health and breastfeeding. Your administrators may not be aware that a third of U.S. maternity facilities, including all the hospitals in Rhode Island and Massachusetts, already have banned the bags. And in Colorado, this is rapidly catching on, with fewer than 40% of Colorado hospitals now giving a formula gift pack. If your hospital still is giving a bag, you might ask yourself why. There are several studies. One new study in LA looking at WIC clients, the respondents said 90% of respondents said they had received a discharge formula gift pack, and those that received the gift pack were half as likely to be exclusively breastfeeding at 6 months as those who did not get a gift pack. An earlier study in Oregon found that getting the gift pack decreased a woman's chance of being exclusively breastfeeding at in the first by 10 weeks postpartum. So the gift bags, there's evidence they do reduce exclusive breastfeeding, and it's time for us to really examine that and break that long-standing pattern. Another reason for your hospital to become baby-friendly is that since 2010, the Joint Commission that accredits hospitals put out a new perinatal care core measure set, and one of the 5 core measures was exclusive breast milk feeding. By the way, there are lots of resources about how to implement this available at the U.S. Breastfeeding Committee, and that's on your next slide. This has been a wonderful step, we feel, the Joint Commission has taken, because this says that exclusive breast milk feeding is a quality measure of a hospital's performance. This step has dramatically changed a paradigm that has been there forever. The paradigm was that if a breastfed baby needed supplement, the supplement had to be formula. And what this core measure has done is told us that when a breastfed baby needs supplement, the first place we look for the supplement is expressing mother's own milk, and supplementing with the mother's own milk that not only gives the baby optimal nutrition, but ensures the mother establishes a generous milk supply. So this is something that your hospital, you're going to find, is being called on to do, because the Joint Commission last fall announced that it's going to expand performance measurement requirements for accredited general medical surgical hospitals to 6 core measure sets. And so beginning next year, hospitals that deliver more than 1,100 births per year are going to need to do the perinatal care measure set as their mandatory 5th set. So stay ahead of the curve and start doing this now. A lot of what this program is about is looking at what's coming down the pike and staying ahead of the curve. Now, there's, like I said, Colorado baby-friendly hospitals are a priority in Colorado as well. And there is now a Colorado baby-friendly hospital priority, which is based on a goal to reduce childhood overweight. And one of the strategies is to increase the number of Colorado baby-friendly hospitals. Jennifer made reference to this in the introduction, that hospitals that participate in this collaborative will receive technical assistance, and there may be some financial support to facilitate their baby-friendly journey. And this is where I want to remind us that there may be only 154 U.S. hospitals that are designated baby-friendly. But now I'm going to hit you with the big news. There are more than 500 of the 3,200 birthing maternity hospitals in the country that are on the baby-friendly path. We are on the brink of a mega trend, and you don't want to be left behind. You want your hospital to be providing the optimal kinds of care with so many other folks coming on board. Next slide, please. Now, another thing about providing optimal breastfeeding services is we get many points of contact with maternity patients around breastfeeding. And this can be a chance to really not only support the mothers, but leave a very positive impression of your hospital. There's contacts in the prenatal clinic where providers, we know that when providers encourage and support breastfeeding, mothers are more likely to succeed at breastfeeding. We know that childbirth education classes need to address how to prepare mothers for an optimal hospital breastfeeding experience. And we need specific prenatal breastfeeding classes as well to get into in-depth information. The prenatal hospital tour is a nice time to remind mothers that your hospital has a golden hour and that grandparents will be holding the newborn right away because the baby will be skin to skin where the baby belongs. You might be telling them about your quiet time in the afternoon so that the breastfeeding mom can rest and be able to meet all her baby's needs during the nighttime and provide exclusive feeding around the clock. The labor and delivery is a chance to focus on the baby's first hour skin to skin and early breastfeeding and delaying routine procedures until the first feeding has been accomplished. The post-birth hospitalization is a time to teach correct latch and teach mothers about cue-based feedings and encourage ongoing skin to skin and 24-hour rooming in and not using a pacifier. So many hospitals, just as I can remember when the first lactation consultants were designated back in 1985. And actually Carol Anderson at Rose was the first really designated position. We had the lactation program at PSL, but Carol Anderson was the first lactation consultant to be, she's still in that position at Rose. And it wasn't long before other hospitals realized that this is going to be a new community norm, that this is expected from moms and valued by moms, and pretty soon having inpatient lactation support became a community norm. Well, I see the same thing happening in terms of outpatient support. For a number of years, there was very little outpatient support except for specialty clinics, such as when we had the lactation program. And now it has become such an expected standard of care that hospitals are now adding follow-up breastfeeding mother-to-mother support groups, as well as individual one-on-one consultations for special problems, and as well as boutiques that offer breastfeeding supplies and support that way. And this is very much valued by patients and really helps women reach their breastfeeding goals. Next slide, please. Being baby friendly helps your hospital staff identify with ideal standards. What hospital doesn't want to provide high quality, cost effective, evidence-based health care that gets optimal health for moms and babies? Your hospital now is a chance to reduce the nation's healthcare costs, promote maternal-child health, reduce health disparities, and even combat childhood obesity. And there's staff pride in acknowledging your hospital's commitment to the highest standards in evidence-based maternity care practices that help mothers reach their long-term breastfeeding goals. What's in it for your hospital? Well, keep in mind that maternity care is a major segment of the U.S. healthcare system. As we showed earlier, that 9 out of 10 Colorado mothers want to breastfeed. They want to get help getting the best possible start. We know that women make healthcare decisions for their family, and when a woman or her family member needs to be hospitalized, she tends to remain loyal to the hospital where she gave birth. It's like satisfied maternity care. Maternity patients can become ambassadors for your hospital. I like to think of it as they bond with their baby and they bond with your hospital. We mentioned the phrase staying ahead of the curve, and it's true that in the future HCAP scores are going to play an even larger role in reimbursement. And beginning this year, providers are shifting from HCAP's pay for reporting to HCAP's pay for performance, and we know that higher scores will count. Also, in staying ahead of the curve, healthcare reform, hospital readmissions reduction program is something that you already are well aware of, but reimbursement is going to change for hospitals that are paid under the Medicare inpatient prospective payment system related to readmission rates. And so the reimbursement changes are intended to incentivize hospitals to reduce overall readmission rates. As I mentioned earlier, we can end up with non-compensated readmissions for infant morbidities that are prevented by successful breastfeeding. And beginning this year, hospitals' Medicare payments will be reduced if readmission rates exceed expected benchmarks. So in conclusion, how are we going to talk to administrators about what's in it for your hospital? Well, the Baby Friendly Hospital Initiative provides an opportunity to improve the quality care that your hospital provides through the spectrum of maternity services. It can enhance your public image and increase your patient satisfaction, as well as engendering staff pride and confidence to know that they are offering the best, highest standard of evidence-based care. And the Baby Friendly Hospital Initiative can potentially, with the long-term benefits of breastfeeding, can improve the long-term health of the families that you serve. Well, thank you very much for being here today.
One of the drawbacks of live stream is that we do not know who's participating. So that's why we would love for you to enter your email address in the comments field. Also use that email address to post some questions to our panel today. I'm sorry that we lost connection briefly, but hopefully you'll also give us some comments on how we can improve our webinar. After we're finished today, please, if you decide to sign off now, please go to the link on the live stream channel to the evaluation, which will also link you to Mary Ann's wonderful handouts. So now I'm going to introduce you to two panelists. You guys can probably slide together. These are our Baby Friendly Hospital representatives. On the right here is Eileen Meisner, who's the clinical manager of Family Education and Supportive Services at Exempla Good Samaritan in Lafayette. And over here on my left is Karen Moore, who is an advanced practice nurse at Poudre Valley Hospital and in Fort Collins. And Exempla Good Samaritan became baby friendly in 2006, and Poudre Valley became baby friendly and designated in 2009. So we have two experts, and my hope is the collaborative that we form will draw more information from our experts within our state and even from outside of the state. So please consider the collaborative as you pose questions to find out how what your needs are and how we can help you. So looking here, do we have any questions? We do have one question. So I'm going to ask first, how did you convince administration to pay for the fees and processes to become baby friendly? Let's start with Eileen.
Sure. I think that probably the first thing you need to do is find out what speaks to your administration. And I think unfortunately a lot of us feel like the bottom line is really the thing that they listen to. If that's your sense, I would go with all of those great things that you know about cost savings. Marianne just mentioned the $13 billion that will be saved. I think that patient satisfaction is a huge issue. When you look at the emphasis that's been placed on patient satisfaction and transparency and HCAP scores, we know that if we're making these folks happy while they're there at the hospital, it just brings more and more good reporting for HCAPs. I don't think that I would probably go first to my CFO, just because of course they're looking at bottom line. I think that your administrative panel probably has someone that is charged with community liaison, community building, vision, mission. Those sorts of things are probably great places to start. And I also believe that CEOs may be helpful, because it's my experience that I think they're a little bit competitive. Very frankly, I think that hospital systems are somewhat compare themselves to their sister hospitals in the same system, and other hospitals that might be in the community that might be competitors. It's a great way to be differentiate yourself in the marketplace.
Mm-hmm. Thank you, Eileen. That was all really great points that she shared. For us, it was pretty much, we already knew our community was asking to breastfeed, and it seemed like that was a good fit for our community. We already had strong lactation services. We already had pretty dedicated staff. It took a while, it took many conversations about baby friendly and what was involved with baby friendly until we bought in and got administrative support. Once we had administrative support, then it was easier to go up that chain and convince senior management that this was the direction that we wanted to take. Our patients were asking for it. We were very, very focused on patient satisfaction. We knew it was the right thing to do for our community, and so therefore the pieces just started falling in place as we developed a patient-centered care model, and we developed then baby-friendly, and we started working away independent of even getting that, the money to go in that direction yet. We made that the focus of our maternity services, so that we were lining up our strategic plan within the service line, so that when we got ready to ask administration to front the rest of the costs, we already had pieces in place so that it was easier to sell it to them. So there's a lot of work that has to happen on the ground level before you even need to start asking for the big bucks.
Great, thanks you two. I do have another question here. So I'll start with Karen this time. How do you accomplish rooming in 24 hours a day?
That is such a huge mind shift for everybody to decide that the baby's best place is at the bedside, because the care providers, the professional care providers, the physicians, the nurse midwives, all seem to have an idea of where the baby should reside, and it may not always be at the mother's bedside. So we started that, first off was to get the staff nurse and to give the staff nurses tools so that she could help those moms when they hit that wall in the middle of the night to keep those babies at the bedside. So we trained all of our patient care coordinators, which are our charge nurses, as CLCs. So we put that out there so they would have the tools and the bedside nurse could feel supported to keep those babies at the bedside. Because it's those critical conversations that happen in the middle of the night that make the world a difference. We then educated, so educate, re-educate, hold staff responsible for the standards you've created. We had to have some critical conversations with our providers, because sometimes, those providers want to fix things. So they go in the morning, the mom's exhausted. And so their fix was send the baby to the nursery. Well, that wasn't really the fix we were looking for, or we knew was the right thing, because based on the evidence, we know the baby should be at the bedside. So I'm glad to report at this point, we function at over an 80% bedside, babies stay at the bedside, more than 80%, it's in the high 80s. And that's been pretty consistent that we've been able to maintain that. We don't really have a place anymore for the babies to go to, because like Mary Ann mentioned, we did staff somebody in the nursery during the whole transition, and our volume in our NICU has grown so great that space, that level 1 space, really is utilized by the NICU quite often, and it didn't seem like we could support that model of keeping one nurse, so we now pretty much do not have a place for babies to go. And is that easier? Is it not easier? I think it's easier in the staff's mind, because they know they have to figure out the tools to keep the babies at the bedside. And for patients, you would think, did patients complain when we said it's our model of care, babies need to stay at the bedside? And quite honestly, our patient satisfaction related to that is totally fine. So I think it's really having those critical, providing the education, supporting it with the supportive literature, giving staff tools, and then having crucial conversations with people who cannot conform to that standard of care that you've set.
And included in the link to the evaluation are links to resources, one of which is an article that describes Poudre Valley's, how would you describe it? It's your challenge, overcoming the challenges
Yes.
to becoming baby friendly, and it'll be available for just 1 week for download. So check out that link. And so let's turn to Eileen to answer how you all have handled the 24-hour day.
I think that Karen is right on. The only thing that I would add is that patient education is extremely important prior to the time that they get to the hospital. If you can ask to use the prenatal classes, the clinics, anything that any touch points you have with the patient prior to their admission, begin to set the stage for this is the way that we do it, help them to see what the benefits are for them, help them to understand the research around restful sleep in a hospital and why that's improved when the baby's at the bedside. I think that those are critical conversations to have ahead of time so that your staff isn't in a difficult situation at 2 a.m. because they will be. And it just kind of propagates itself if you can do that education ahead of time.
I so agree with that. I'm so sorry I missed that point too, because it's those moms who are coming back in for their second baby, and the first baby, the baby, spent their night in the nursery. Now the second time around, we're saying, well, no, that's not going to work so well for us this time, and they're like a big disconnect. So truly that is preparing your clients for their experience in your hospital. It cannot be stressed enough.
Very good. Key point, huh? So here's another question. How did you get buy-in from the staff, Eileen?
I think that it's important to find those informal and formal leaders on your unit. Ask them to help you examine your current status. What are the policies that you have in place for supporting breastfeeding moms and families? I think that there is so much literature available that if you can start very non-threatening, I wouldn't suggest saying, hey, let's be baby friendly. Here's the policies we're going to start following. It never works very well to be told what you're going to do. It always works better to have people along the journey with you, discovering what is best practice and examining your current state and looking at small ways that you can improve. There's no doubt that baby-friendly designation will come up. I also feel like hiring practices is an important part of this. You have existing staff and you have an existing culture, yet you're trying to plant the seeds before people even come in. And although people have heard baby-friendly, most OB staffs know that word, they may not know the nuances of the criteria that a hospital needs to follow. And to be upfront with that and say, here's the things that we follow. Are they things that you feel like you could support? Because it is a cornerstone for us. Setting that right up front is really incredibly important. And as Karen mentioned, it does build on itself. There's a lot of pride that comes along with being baby friendly. And in this era where trauma designations and electrophysiology labs they're flashy, incredibly intriguing and interesting technologies. Babies are babies, and we've been having babies a long time. So to have something that your staff can take pride in and be part of the build, many hospitals are doing so many of these steps already that it just helps to reinforce the pride that they have in their hospital and brings recognition to them.
And I agree with all of that. I think that I definitely think you need the cheerleaders. I think that having a strong lactation team and who are well respected, as well as having your frontline folks be trained specifically as CLCs so that they can be the cheerleaders for that. I think it's important to start small. I mean, I think we started out gangbusters, we're going for baby friendly. Well, guess what? People said, well, we want to be mother friendly. Well, how can we be mother friendly? We don't want to just be baby friendly. What about those moms who want to formula feed? We're no longer going to support them. How can we, that just doesn't seem fair. Women have the right to choice, and we just then had to back up and say, let's go back and look at the evidence. Let's manage our practice. Let's make sure that we're moving forward in a strategic plan so that we could eventually bring people along with us, as well as making sure that your team is multidisciplinary. So you have your nurse midwives, and you have your physicians, and you have your OBs, and you have childbirth educators. And so that you're able to bring everybody forward together so that you do get strong buy-in. I think it's really easy now. I think it's easier now. I don't know that it's ever easy, but I think it is easier now because we have Joint Commission saying this is the right thing. We have the state of Colorado telling us this is the right thing to do. we have so many pieces in place that is going to help bring everybody forward, that we no longer can just say, no, we're not going to do this. This isn't the way we're going to practice. We're going to keep babies in the nursery or whatever those practices used to be. We are all being forced to move forward as a group, and I think that really provides a lot of support for anybody who yet hasn't made these practice changes.
Thank you. You know, we have about 7 hospitals that are at some phase into entering baby-friendly right now in our state. So, 7 already very interested. And I know that this next question has to do with a concern that many of them have, is that how are we able to complete all the staff and provider education? So, Karen, would you mind starting with that?
I think that's really, a lot of people ask me this question all the time. And I think that people think, well, let's get that 20 hours, boom, and get it done. But I think what you need to realize is that we need to educate on those mandatory steps and provide that as our foundation to move forward. And even today, what was provided by Mary Ann is a great foundation, because it does really discuss the 10 steps and the literature. So this could be used at any format as a foundation to move forward. So you start with just that foundation information, because as you find as you're on your journey, your even if it's a simply 3-year journey or a 5-year journey in our case, that there is education that occurs along that, because there's pieces that you need to keep building on. We just did our whole department just completed education on skin to skin and transition, so that we really were providing that immediate skin to skin for all births. We haven't yet, C-sections is still being ironed out, but for all vaginal births. So even though we're coming up on redesignation, we're still providing additional education. So I think you need to provide a foundation, then you need to figure out where you're not meeting your goals and re-educate. And I think that's really important. As far as providers go, we do struggle with how we can keep our providers. We put in place education for our providers so that they can come to education, but it's difficult to figure out exactly. We've had those conversations. Can we tie it to credentialing? How can we really beef it up and make some point that it's more mandatory for them? Because Baby Friendly says that they want us to demonstrate how many providers we've educated and how many different ways we've provided that education, and that it would be 3 hours of education. So we still struggle with that one, and anybody who has better ideas, I'm all about it.
Like 1 minute. Do you have anything to add in your minute?
I agree. There's an awful lot of challenges with that. I would say that that's probably the biggest challenge in this journey. I also agree that it seems to stick better when it's done in small doses. However, it is a requirement, I think, to be as varied as you can, providing some in maybe a didactic or classroom setting, maybe some self-study journals. We also actually have our staff attend a prenatal breastfeeding class, because then they're seeing what the patients are, or they're hearing the way that we're telling patients, and we can all be consistent. That consistent messaging is incredibly important. We do an awful lot of shadowing. It's pretty flexible how you do this.
Right.
You just need to find what is going to work and what seems to really help that information and those practice standards stick.
Thank you both for contributing to this webinar and sharing your expertise and experiences. And thank you, all of you, for dialing in so early in the morning. And, as Karen pointed out, one of you pointed out, that this would be a good 1 hour introduction to Baby Friendly that can be used by your staff, and you have access to it just by linking to it. It'll be up there for at least a year, so you can watch it again if you want to. If you felt like you missed something, and don't forget to go back to the link to select the handouts. And I'd just like to really thank Dr. Neifert, Karen, and Eileen for joining me today. And please continue to stay informed about the hospital projects that we're doing in Colorado by giving us your email address in the comments field before you log off. And thanks very much. Have a great day.
Thank you.
Bye.